Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on gastrointestinal gram-negative rods. Until now we discuss about different types of gastrointestinal pathogen, or you can say the bacteria. Now today we come up with one new kind of bacteria which causes the diseases in the gastrointestinal tract. And this family of this bacteria is called as the Vibrio family. Okay, Vibrio family. Now, so basically today we are going to discuss about the Vibrios. Okay, Vibrios. Now, what things we're gonna learn about these Vibrios? I'm just simply saying that we are specifically in today's lecture maybe deal with you can say bacteria which causes a very daily disease called as the cholera. So basically we will discuss about the cholera bacterium, and cholera bacterium comes under the family of Vibrio family. So we will learn about this Vibrio cholerae and under these headings. First we will discuss the introduction, then we will go with understanding their characteristics. Okay, how they look like, what special thing is present in them, and then we will discuss their pathogenic strain. We will discuss the transmission, how this Vibrio cholerae is transmitted from one person, from infected person to the another healthy individual. Then we will discuss their morphology, their appearance, their size and shape, about their antigen. Okay, and we'll also see that, okay, fine, once it enters in a host body, okay, in which way they are causing you can say silent symptoms, what is their, you can say, mode of hijacking the cellular machinery. Okay, and then we will discuss the clinical manifestation, okay, their signs and symptoms, and we will also see, okay, fine, now it comes in the body, but we have to see the you can say bacteria under the microscope. In order to establish any clinical judgment, we have to clear that, okay, this symptom is caused by this Vibrio cholerae. So for that there is some special you can say test, and that is comes under the diagnostic evaluation. Then we will discuss about the treatment, that what are the remedy, how infected persons can recover from this Vibrio cholerae infection, or so-called cholera. Then we will discuss about their prevention. Is there any way to permanently prevent this cholera infection? Fine. Now let's make the heading Vibrios. Vibrios. See their name. Vibrio means, literally it means comma. Okay, it means the comma shape. Commas. Now, you know how commas look like. Generally, we write any word and we just putting like this. This is considered as a comma. Okay, in the sentence, you can say making, we are using this comma. So this bacteria is basically a comma shape. Okay, this bacteria is basically a comma shape, and it is a very dangerous bacteria in ancient time. Okay, and for surprisingly, it is, it is originated in India. So first outbreak of the cholera, which is caused by the Vibrio cholerae bacterium. See, Vibrio is a genes. Okay, it's a genes. Writing down. It's the one genes which comes under the family of Vibrionoceae family, which is closely related with the Enterobacteriaceae family. Okay, in that the Salmonella. Okay, we discussed the H. pylori bacterium. They all come in the Enterobacteriaceae family, but this bacteria, they are not coming under the Enterobacteriaceae family. Rather, also have one separate family, okay, called as the Vibrionoceae family. Fine. Now, the things which we have to understand is that this Vibrio family, it have the many pathogenic strain. It have the many pathogenic strain. But for us, we have to look for the two. Okay, the one is called as the Vibrio cholerae. Okay, Vibrio cholerae, and another one is called as the Vibrio hemolytic. Okay, Vibrio hemolytica. So this Vibrio cholerae, it causes the cholera. Okay, acute diarrheal condition. Acute diarrhea. Fine, it is caused by the V. cholerae. Now the surprise is this bacteria, its first outbreak it's originated itself in the India first. And which region of India? Yeah, it's in Bengal. So Bengal, it is originated in the Bengal, or you can say the first episode, the first outbreak of cholera is happened in the Bengal, and till now there is a 7 episodes. How much? 7 episodes of this you can say the cholera is already, you can say, happened, and it's originated initially in the India, and it's, you can say, spread across the various different you can say continents. It's spread to the Asia, you can say the Europe, America, okay, even in the Africa region. So everywhere it's spread. Okay, now did it mean that is only, you can say, known, you can say, after the 1804 to 1829, 1821 century? No. It's mentioned in the previous, you can say, ancient time in the Sanskrit literature. So this cholera-like disease, okay, this cholera-like disease, it is mentioned in our Sanskrit literature. Sanskrit literature. Okay, you know that initially, like the people were not aware about the microorganism. They consider that these organisms are invisible organisms. We cannot see. These are something called as God mercy, or it's like some, you can say, it's just a result of karma and whatever. Are you getting the point? But this cholera-like disease, which is mentioned in the ancient Sanskrit literature, it is now established, and it is first time seen by the Robert Koch. Okay, so first time it is seen by the Robert Koch, or rather, used more specifically, Sir Robert Koch are the one who first time isolate in a pure culture this Vibrio bacterium. And now, when he isolate, he seen that it is a small, okay, I'm talking about the bacterial characteristics now. It's a small, a comma-shaped, facultative anaerobe, okay, and mainly, you can say, a single flagella is present. Single flagella is present. Getting the points? Yeah? No problem? So let's summarize what we studied. We studied that the Vibrios is a family of comma-shaped bacterium. Fine, and this bacteria, you can say, this family members, they comes under the family of Vibriosi family. Okay, and there are more than, you can say, thousands of bacteriums comes under this family, but for our study we have to only concentrate on these two, and among these two, the mainly is one, the Vibrio cholerae, which is causing the endemic cholera. Fine, and they also causes the, you can say, cholera, or mainly the gastrointestinal gastritis, you can say. Okay, gastritis and extra gastritic symptoms occasionally, but endemic cholera is only caused by the Vibrio cholerae. Fine. Now, It started in the cholera attack first. You can say pandemic is happened in the west. You can say the Bengal, okay, and then it's radiate to different continents like the America, Africa, fine Somalia, and other different states. And it's the first time seen by the Robert Koch. Remember Sir Robert Koch? And what he's seen it's a small, viable, okay, and facultative anaerobes, and it's possesses a single flagella. Fine, no problem. Now, till now it causes the millions and millions of, you can say this, the morbidity rate are high previously because doctors was unaware about the accurate management. But what happens in this disease? The things which happen in this cholera, okay, now let's first make heading and we will only specifically, you can say, discuss this bacterium in detail. Fine, the Vibrio cholerae. So make the heading Vibrio cholerae. Vibrio cholerae. Now, this Vibrio cholerae, you are aware with their general characteristics, that this is a comma shaped, okay, facultative anaerobes, fine, first time discovered by the Robert Koch, and there is more than 200 strains of the Vibrio cholerae, okay, more than 200 strain of Vibrio cholerae based on the O antigen. Based on the O antigen, the Vibrio cholerae are classified into 200, you can say the serogroup. More specifically, it's called the serogroup. Serogroup means species are differentiated on the basis of their antigenic property. Okay, on the basis of their antigenic property, we are differentiating the species. Fine, and there are more than 200, but we have to only look for the two. Okay, the one is called as the O1. Okay, one is O1 and another one is the O139. These two, okay, serogroups. These two serogroup of Vibrio cholerae causes the endemic cholera. It's called the endemic cholera. Fine. Now, what happened in this disease? First we have to understand their, you can say, transmission. So their transmission is generally happened by, you can say, person to person or eating the contaminated foods. Fine. If eating a contaminated food, now suppose it is enters in a human body, and mainly it is not remember, this bacteria have to suffer in our acidic environment, and you know that the stomach possesses one high acidic fluid, okay, enzyme called the hydrochloric acid, and these bacteria, they are not resistant to the hydrochloric acid, but rather it's some prone, you can say, sensitive to the acids, and it's not an acidophilic, okay, it's an acidophobic bacteria. You should write it down. It's a acidophobic, means it have to suffer, okay, by the action of hydrochloric acid. Fine. It means it have to acquire certain big, you can say, the large size, or it can capsulate their body. Okay, capsulate their body. So fine, it's capsulate their body, and now it's become, you can say, strong enough to cross the gastric portion of our body and goes to the intestine. Now when it goes to the intestine, it's meet with the intestinal cells, intestinal epithelial cells. Now in interstitial epithelial cells, it's start, you can say, first it's adhere, it's colonize, then it's multiply, and by multiplying it secrete, you can say, certain, you can say, toxins which will bind with the receptors present over the intestinal epithelium. And now once it bind, the one, there is a two antigen. Write it down. Whenever you talk about the Vibrio cholerae, you should talk about the two antigen. Okay, one is called as the A type. Okay, another one is called as the B type. Now it's a monomer, and beta type is a pentamer. Okay, beta type is a pentamer. Now A type, which is a monomer, it, you can say, hijack one enzyme what's involved in the electrolyte balance. Okay, and that enzyme is called as the adenylate cyclase. Enzyme is called as the adenylate cyclase. Now what happened? When these toxins, they bind with the adenylate cyclase, or you can say the CN, it disrupts the CAMP pathway. And now there is the excretion of chloride ion, which is followed by the sodium and potassium ion. Then the water will also goes out, and there will be a severe acute diarrhea. Fine, severe acute diarrhea. So in the case of this cholera, what happened is excessive fluid loss from the body. So the first clinical sign and symptoms will be the dehydration. Now that this dehydration has become so severe that it's take away the life of a suffering person. Okay, and that condition is called as the cholera gravis. Condition is called as the cholera gravis. Write it down. The condition is called as the cholera gravis. Fine. Actually, the electricity went off, so I'm shooting the lecture in a very fast way. So have patience. We will have the detailed discussion over this cholera bacteria in future. But for a while, you just understand. Okay. If you have any doubt, you can comment down. We will shoot again the lecture. Fine. No problem. Now, so the first one is the dehydration, because there is an excessive loss of, you can say, electrolyte as well as the fluid. Now, once electrolyte and fluid loss becomes severe, okay, as I said, this can take away the life of the patient, and that condition is called as the cholera gravis. Now, this cholera gravis, it is characterized by excessive first loss of the fluid, then there will be a sunken eye, there is an impairment in the skin tursidity, fine, and there is a BP fall down, okay, and just BP fall down, there is a less urination, okay, so called as oliguria, then there will be a polydipsia, the excessive thirst, okay, and these all conditions eventually lead to the seizure-like condition, okay, seizure-like condition, and then there will be a hypovolemic shock, and that can, you can say, take away the life of a suffering patient. So that's their you can say the pathogenesis, and the transmission is from once its enters in the body, there will be excessive fluid, then that the suffering patient will shed the bacteria within the 24 hours. I'm talking about the symptomatic patient. And asymptomatic patient, it take 2 to 3 days. And there's one research which shows that the blood group O, I know that blood group O is called as the universal donor. It's a very precious. It must be the precious. But the main thing is that this Vibrio, or you can say the cholera disease, is, you can say, more susceptible. The O blood group person are more susceptible to this cholera. Yeah, they are more. And the person who have, you can say, the concomitant infection. Concomitant infection refers to a person is suffering simultaneously with from more than one bacterial disease. Okay, so there is a risk factor. So risk factor for the blood group O. Okay, another is called as the concomitant infection. Means a condition where there is a more than one disease are present simultaneously. Okay, these are the risk factor. And about the clinical manifestation, you've seen that there is mainly this the cholera is a disease of disturbing the electrolyte and the fluids. Okay. Now comes to you can say diagnosis. Their diagnosis is generally happen in the lab by examine the stool. by examining the stool. Okay, and there are different types of agar are used. One is called as the one is called as the thiosulfate agar plate. Okay, thiosulfate agar plate. Fine, no problem. Now coming to their treatment, their treatment is mainly based on managing the, you can say, the fluids, okay, and electrolyte. And this fluid and electrolyte management along with administration of zinc, you can say, supplement is very important when it comes to the under the 5-year, you can say, in patient. Okay, so under the 5-year patients, we have to go with the electrolyte, you can say, replacement with the zinc supplement. But for the adults, we have to look for the oral dehydration therapy, and if it's not managed, then we have to go with the intravenous therapy. And the main thing which is crucial in the management of this cholera is that we have to understand the speed, in which speed you can say we are administrating the fluids, the electrolytes to the patient, okay, to the patient, and that is understand by their patient's body weight. Okay, so there are a proper guideline of the fluid replacement or fluid administration. Fine. Along with that, that's seen that there is a deficiency of you can say vitamin A can also one risk factor for developing the cholera. Okay, so retinol deficiency is a one risk factor, so we have to also go with some vitamin A supplement. Fine. And apart from that, if we talked about the, you can say, anti-emetic, and there is a severe vomiting. Remember, the vomiting is also present. Okay, so vomiting is also present in the case of cholera. So if you administered a patient with the anti-emetic drugs, okay, or for relieving from the vomiting diarrhea, if you provide the anti-motility drugs, then there is no use, there is no effect. Rather, it's, you can say, exacerbate the symptoms of this cholera. Okay, so anti-motility drug as well as anti-emetic drugs are no use. And if talking about coming to their, you can say, antibiotical therapy, if we use the antibiotics, then there is a multi-strain, you can say, resistant of antibiotics. So you have to check the endemic population, that okay, this population is not responding well to the tetracycline. Okay, then you have to go with the another like doxycycline, okay, doxycycline, and there are other, you can say, class of antibiotics. Now if we're talking about their prevention, then there is no any perfect vaccine for this, you can say, the all type of the cholera strain. Okay, all type of cholera serotype, there are more than 200 serotype, but these two are the endemic, and there is a various biotypes. Okay, biotypes which causes the specific, you can say, a specific kind of cholera symptoms. Okay, so there are two vaccines which is effective. Okay, which is effective. So let's conclude today's class. Basically, in today's class, we discussed about the Vibrios, which comes under the family of the Vibriniaceae family, which is closely related with the Enterobacteriaceae family. Mainly we seen the, you can say, Vibrio cholerae, a causative agent of the cholera. Cholera is what? It's a diarrhea. It's a acute diarrheal condition where sometimes it's in the severe condition, like in you can say cholera gravis, it can take away the life of a patient. Fine. But generally there is a vomiting and there is excessive loss of water from the body, okay, and that lead to the mainly disturb the electrolyte and fluid balance in our body. Then we discussed about the bacterial characteristics, their morphology, their antigen, fine, their prevention, and remember this is not a very big disease, okay. There's not, but the management is very crucial. So you have to pay the attention, okay, to understand the good physical and you can say the history collection, the good physical examination. Then you have to consider the patient's age. You have to consider the the speed by which the fluids are, you can say, excreting out from the body, and by that you have to plan the replacement either by the, you can say, oral rehydration therapy or intravenous rehydration therapy. And if it's the infants, then you have to also give the, you can say, the zinc supplement. Otherwise, alone giving the ORS can exacerbate the symptoms in the, you can say, infants. Okay, and the people, if talking about their prevention, so there is not any very good, you can say, vaccine, but there are two effective vaccine, and it depends upon the endemic population. It depends upon the specific serotype of the cholera bacterium. So by this we finish with the today's lecture. Okay, due to the shortage of time and there is no any good electricity, so I am just stopping today's lecture. So thank you for having me. Bye. Have a nice time.